I believe from a practical or clinical perspective that hyperthermia, PEMF, Sono photodynamic therapy, and other botanicals also kill circulating tumor cells. And I know the Beljanski Foundation will have more evidence of that in the time to come, so very grateful for that. Thank you, Sylvia. A few months ago, I was in Finland, and there was over 400 attendees to this conference called the International Photodynamic Association World Congress. And out of the 400 plus attendees, I was one of 5 clinicians. The rest of them, with all due respect, are geeks in the lab, doing the animal studies, the in vitro study, which we are so grateful for, because what they're doing is validating what I have done since 2003, using Sono, sound, and photo light therapy to fight cancer cells. And so these brilliant researchers from major universities across the world, literally, are researching photodynamic therapy like you wouldn't believe. I mean, extensive research, a lot of fun going into researching photodynamic therapy. And why is this so? Because oncologists are frustrated. The results of chemo, radiation, and surgery are just not there at long term. And so Sono photodynamic therapy has 4 major benefits. One is it has direct anti-tumor effect. And, it's all described here. Secondly is that it stops the blood flow to cancer cells. And remember, a tumor cannot grow beyond 1 or 2 millimeters in size without having angiogenesis or increased blood flow. And so any therapies that decrease blood flow to tumors, you're starving them, you're decreasing their ability to eliminate their toxins. And number 3 is that Sono photodynamic therapy also has benefits on both ends of the immune system, the innate, the quick-acting immune system, and the long-acting immune system. And then fourthly, as was shown by Dr. Burke at Harvard years ago, one of my mentors, he said he found in his studies that Sono photodynamic therapy also is very good against pathogens, fungi, viruses, bacteria, and so forth. So there's diverse ways to use these type of therapies intravenously, interstitial, directly into tumors. We could do endoscopically to go into the esophagus and stomach. We have one of our star doctors here, Dr. Fernando Mercado at our Tijuana Center, and they've done a number of endoscopic procedures for esophagus and rectal and lower colon tumors. And so more recently, and actually Chris Wartzer sent me this, a text about this a couple of days ago. At the University of Michigan, they just announced that the FDA approved something called histotripsy. It's the first non-invasive, non-ionizing, non-thermal ablation technique based on sound, which basically is sonodynamic therapy, right? And so what we have been doing for so many years, and that was today on October 9th, the FDA officials awarded clearance to Histiosonics, a company co-founded in 2009 by the University of Michigan engineers and doctors, for the use of histotripsy to destroy targeted liver tumors. Right? So, wow. It's like another feather in our collective cap of what we've been doing for over almost 20 years now, right? Coming to light. So hypothermia. I know in Germany there isn't a clinic that treats cancer without doing hypothermia. I want you to understand that hypothermia is a mainstay therapy for cancer. It has 3 basic mechanisms. One is that it has non-toxic cancer-fighting effects. 2 is that it modulates the immune system. And 3 is that the thermal effects increase migration of immune cells. It does a lot for your immune system. So if there's a tumor in between all these tables and I jump off this platform here and I try to navigate myself to the tumor, it's going to be hard because, the seats are together, you guys are kind of close by, there's bags in the way. And so that's how the terrain is in the tumor microenvironment. So what hypothermia does, it allows the immune system to navigate through that terrain and get to the tumor cells. So it would allow me to go through those aisles easier so I could go to the tumor cell. Okay? A great benefit of hypothermia. Immune modulation, so we're going through the 7 key principles very quickly. Immune modulation, as in life, everything is about balance, right? Regulation. And so if the immune system is overactive, you're going to have on the left side autoimmune diseases, and on the right side you're going to have allergies. If it's underactive, you're going to have an increased risk of infections and or cancer. And so balancing and regulating the immune system is of utmost importance. And these are a lot of the immunotherapies that we do at Hope for Cancer. Of course, we use Immunobel extensively. We use the Yankobel also from the Beljanski Foundation extensively also. Mistletoe, we've developed our own immunotherapies also that we use at Hope for Cancer. And briefly talking about it, the MAF, macrophage activation factor, is one of the immunotherapies we use. The latest research out of Osaka, Japan, where this was developed, is that the MAF increases telomere length. People familiar with telomeres, right? At the end of the chromosomes, the longer the telomeres, the longer we live. Patients with cancer or chronic disease have shorter telomeres. So what we know now is that the MAF increases telomere length. Three months of using MAF, you have an 11% increase in telomere length. 6 months, you have 27% increase in telomere length. So I started using MAF since last November after I checked the length of my telomeres, and I'll check it again in another few months and go from there. But very important immunotherapy. And there's mistletoe, our soda. I want to explain our soda a bit, but before Jonathan will be very happy. Jonathan Otto will be very happy for me to explain our soda a bit. But before that, a short video of how that quick-acting immune system and the macrophages, which is the target of the MAF immunotherapy, how it works to seek out cancer cells and other microbes. So in this video, you will see a macrophage. You'll see the pathogens first. This is like a bacterial circling in the bloodstream. And then you see a macrophage coming out and literally vacuum cleaning, sweeping, going through the bloodstream to get rid of pathogens and cancer cells in our bloodstream. And this could happen in the tissues as well. So very short video, but it's important to visualize. So what if you remember this, and throughout the day you visualize your macrophages, because you have macrophages in every tissue in your body. And cancer cells are very intelligent, remember, smart, and they suppress macrophage activation. So they keep the policemen in the police station so it doesn't go out to the scene of the crime. And so with the MAF therapy, we're able to mobilize those policemen, the macrophages, get them out of the cells so they could do what you just saw. Surveillance and destruction of pathogens in cancer cells. So our soda is a very important immunotherapy that we developed at Hope for Cancer a number of years ago, where we collect either the urine, pleural effusion, fluid from the lung, or ascites, fluid from the abdominal peritoneal cavity, and then it goes to a 20-step filtration process, and then we re-inject those antigens. Because cancer cells release antigens. Breast cancer, CA15-3, CA2729, right? Gastrointestinal cancer, CEA, CA19-9 for pancreatic cancer, CA125 for ovarian cancer. So these are antigens, proteins that are secreted by the cancer cells, and they're eliminated in the urine. So we collect 1 gallon or 3 liters of the patient's urine, we send it to our specialized lab, and they make this arsota, which comes in vials. They're injected intramuscularly. So when these antigens, these proteins are injected into the buttock and circulate in the bloodstream, they bind to your antibodies. And now it causes an antigen-antibody response, and the antibodies say, oh, I see you. You have a pink shirt on. You're a bad guy. You're a cancer cell. So it launches a direct cancer attack. Okay? And of course, there's some that are drinking the urine, but that's a topic for another time. Right? So we do it in this way, and very effective immunotherapy. And we recommend to do the collection every 3 to 6 months because cancer cells are mutating all the time, and they have a different antigen presentation as time evolves.